Good afternoon and welcome to the CDP Supporting Immigrant Populations in Disasters webinar with our co-hosts, the Houston Immigration Legal Services Collaborative and Grantmakers Concerned with Immigrants and Refugees. This is Regine Webster, Vice President at the Center for Disaster Philanthropy. A few reminders before we get started. First off, this webinar is being recorded. Secondly, if you look at the bottom of your screen, you can submit any questions that you might have at any time throughout our conversation using the little Q&A box at the bottom of the screen. And what we'll do is we'll go ahead and answer them at the end of our panel presentation. Again, use the Q&A box. If you're on Twitter, please go ahead and use hashtag CDP4Recovery to share the discussion. To provide us with insights on how best to address the needs of immigrant populations in disasters, we have these speakers joining us today. Kevin Douglas is the Director of National Programs for Grantmakers Concerned with Immigrants and Refugees, GCIR, a network of local, state, and national funders who seek to leverage their grant making to expand opportunities and address challenges facing immigrants, refugees, and their communities. Kate Vickery is the Executive Director of the Houston Immigration Legal Services Collaborative, HILSC, a network of nonprofits, funders, law schools, and community stakeholders that provide legal and social services to immigrants in the greater Houston region. And lastly, we have our very own Sally Ray. She's the Director of the Center for Disaster Philanthropy Hurricane Harvey Recovery Fund, where she's currently managing nearly 70 funded grants provided through CDP's largest recovery fund. I want to take a moment to welcome all three of you and to give our thanks to you, our panel, for taking time to speak with us today. We're going to begin now with Sally. She's going to share some information about the inequity of recovery for immigrants, immigrant communities, and as well as for communities of color, low-income communities, and other vulnerable populations, and how CDP's funding is put to work to support that recovery. Sally?
Thank you, Regine. I want to share just a little bit about my experience as a grant maker and as the director of CDP's Hurricane Harvey Recovery Fund. First, you should know that diversity, equity, and inclusion matters to CDP. Our work has a focus on supporting vulnerable populations with disasters, after disasters. CDP is a leader in funding disaster recovery for vulnerable populations, and we lead by example by helping to connect the stark reality of vulnerabilities and disasters for the broader philanthropic world. Through our Hurricane Harvey Fund, for example, we're leading by example. And when CDP focuses on our grant making on supporting recovery for the most vulnerable, we know that we're supporting a holistic community recovery. Next slide. I knew all of this, of course, when I first became involved with the fund. I also knew that private philanthropy can provide and must provide the flexible funding that government funding can't. But I had a couple of experiences early in my tenure that informed that focus and helped me find a path toward a deeper understanding of why it's so critically important to be inclusive in our disaster philanthropy. Even when you know that disasters disproportionately affect vulnerable communities, seeing how it plays out differently, seeing how it plays out is different. My aha moment was that there is an opportunity here in Texas for courageous grant making. Let me tell you about a community in LaGrange, Texas that I first visited in February 2018, 6 months after Harvey first struck. LaGrange is a town between Houston and Austin and is located along the Colorado River. It's the county seat of Fayette County, and it isn't a very large town, but it's surrounded by some ranches, agriculture, and has a pretty vibrant tourist culture because of its scenic hill country vistas, its location along the river, and because, honestly, the ZZ Top song that has the name LaGrange. While there, I visited a neighborhood called Country Way Village that is a mostly mobile home community located along the Colorado River. Most of the folks who live there work in the service or agricultural industry, and almost the entire neighborhood was flooded, some homes totally destroyed. Next slide. Yeah. When I looked around Country Way Village, I was pleased to see a lot of evidence of recovery underway. New homes were replacing old ones, repairs were underway on those that needed them, and some repairs were completed, homes were lifted, all the things you like to see post-disaster. Next slide, please. But I also saw something else. Some of the homes were clearly still damaged, and you could tell little or no work had been done on them. In some cases, they were even abandoned, but in others, it was clear that someone, or maybe an entire family of someone, was still living there in the condition that the home was in. When I asked my companions who were members of the long-term recovery group doing the work in Fayette County why these houses didn't show the same signs of recovery, they got a little quiet and almost whispered, saying they were likely immigrants with fragile document status. The organizations had tried to help them. The residents of these homes were afraid to accept that help. They were trying, but there was not a level of trust there that they were seriously seeking to find. And they didn't know how to bridge that gap, how to reach that level of trust. Next slide. I found a slightly different story when I visited a ranch this past Texas. These pictures are from a home where an undocumented couple lived. Though they didn't want their individual pictures taken or any photos taken that would identify specifics of their location, they'd welcome the volunteers from all hands and hearts into their home to help them. And they were happy to share with me how grateful they were for the help. All hands had worked hard in this community to build a bridge of trust with those that were there who most needed the help, by working through local faith-based organizations and having themselves a very diverse staff and a very diverse volunteer crew who could overcome a lot of the language barriers. They had proven themselves to be allies, and they were able to help in this case. Next slide. So what did these two experiences teach me? That building an equity lens into our grant making by strategically funding organizations working with vulnerable populations, especially immigrant, refugee, migrant, and undocumented people, is critical. That we have to seek out experts in the field to help with this focus and provide capacity building funds to support their work. This is what we did with our friends at HILSC, Kate on the call today, and Equal Justice Works. And we often pick the brains of our friends at GCIR. Using available tools to help identify which organizations truly are focused on this work and support them. Tools that we find from our friends who are experts in the field. And funding those who wish to support these communities and are willing to put in the work to learn how to do it. So funding those that may not necessarily have built that bridge of trust, but helping them figure out how to do that and funding them to do that. Next slide, please. And the good news is that there are a lot of local organizations who are ready and willing to put in the work, including some now working in LaGrange. When we focus, my key takeaways here are when we focus on holistic and inclusive recovery, it is key to make sure that the whole community recovers. And inclusive recovery is not easy, but it's critical to make sure the whole community recovers. And obviously, private philanthropy can help where government agencies can't or won't. And when in doubt, most importantly, ask the experts like Kate and Kevin here on the call. Thank you for listening to my stories in Texas. Regine, back to you.
Thanks so much, Sally. I'm so grateful to hear about how you've been able to focus some funding on these vulnerable communities in Texas. Reminder to those of you who are listening in, we'll provide an opportunity for each of our speakers to answer questions at the end of all presentations. You can ask questions by entering them into the Q&A box at the bottom of your screen. And now we're going to turn to Kevin Douglas, Director of National Programs for GCIR. Kevin?
Good morning, good afternoon. Thank you for inviting me to participate in this discussion. We're really grateful to have the opportunity to talk about the impact, particularly on immigrant, refugee, and asylum seeker communities in a disaster context. And so this work is really important to us. We're approaching 30 years in the funder space of really helping philanthropic entities really think about how they target their grant making to support immigrant, refugee, and asylum seeker communities, and really making sure they have up-to-date information, policy awareness, best practices, et cetera. And so we're happy to have partnered with you and to be part of this conversation today. Next slide. And so part of what we want to talk about is what does it mean to support immigrants more generally before we even get into the specific disaster context. And it's really important to just get this initial baseline grounding of before you get to the specifics of a differentiated approach in a disaster context of actually positioning your foundation or your philanthropic entity to embrace giving in the space of immigration prior to that sort of crisis point. And so the first point that really is worth mentioning here is the fact that it's important to have an appreciation and understanding of the role that immigrants play in communities at large, and understanding the demographic context of a community and how that relates to the ability of a philanthropic entity to really achieve its goals and its theories of change. So if a foundation is really thinking about health equity or education, building economic security, or any other end goal to improve the quality of life for any community, it can't achieve those goals if it's not factoring in the immigration context and taking into account the immigrants in their community, because we know that immigrants are, a vibrant and growing part of this country. Over 44 million individuals living in the U.S. today are immigrants, which is over 13% of the population. We get up over a quarter of the population if we're including the children of those immigrants. So sort of an inescapable reality that immigrants are a part of our communities. They play important roles and they're there. And so if a foundation, if a philanthropic entity is really looking to maximize their impact in whatever their chosen focus areas, necessarily they need to be thinking about what are the differentiated approaches and strategies for their immigrant community. And there's also a benefit to think about in this context of if you're looking at an issue such as health equity or education outcomes, recognizing that unfortunately for many immigrant communities, they're actually ranking lower in those measures, you can actually achieve an outsized impact by focusing on a strategy that brings up the outcomes for that community, even if they're numerically a smaller portion of the community, because they perhaps are unfortunately less well positioned in some of those markers, you can have that bigger impact by focusing on them. And then the last point I just want to mention here as well is because we're in a space now where there's a lot of rhetoric and heated discussions about immigrants in our community and unfortunately a lot of misinformation, just a reminder that when we talk about an immigrant community, we're talking about a broad range of individuals. And yes, of course, there are members of the community who are undocumented for a variety of reasons. And then there are those who are, fully naturalized citizens and all sorts of statuses in between. And although we often focus on the deficits of this population, and in particular, it makes sense to an extent if we're talking about philanthropic investments to support a community to think about what are those touch points of need. There's also a wide variety of talents and strengths and skill sets that immigrants are bringing into a community. And so just having this broad understanding of the role and importance of immigrants in community, I think is a fundamental prerequisite to thinking about a specific challenge as it pertains to disaster relief. And so moving to the next slide, one of the ways that we like to help people think about this, because as mentioned earlier on, we work in a variety of communities across the country that exist in all sorts of geographic, political contexts. And so the issue of immigration and immigrants looks a lot differently in different communities and means different things to different people. And so we like to help people think about what it means to look at this continuum of entry points, so to speak, of what it could look like to support immigrants generally. And so, at the most base level, it's sort of what I talked about, seeing immigrants, refugees, and asylum seekers as members of a community. And it's a short walk from that recognition to appreciating the value of investing in social services for that community, whether you're talking about health services, education services, training and workforce access, civil legal services, whether it's housing counseling, et cetera. There's a wide range of services that you can just tweak services a little bit to make sure you're capturing that portion of your community. And that's a great entry point, starting point for a lot of folks, and particularly if it's a little bit challenging sometimes to engage boards or other folks who have some trepidation in this space. This is a really easy way to think about getting in and supporting immigrants. But then there's also sort of another place where a lot of funders land is really looking at immigrants not as just sort of individual members of a community, but part of a broader social political context, and really looking at immigration as a policy issue, and are choosing to invest in change work. And so that's, maybe looking at leadership development in immigrant communities, or working on challenging the narrative or evolving a narrative in a community, supporting organizing and advocacy efforts. There's even groups leading some of the challenges to federal policies that are passed. So there's a broad range of places, funders can step into this space. in any context. And so I think it's just important to think about that as we think about immigrants in a disaster context, because there's implications along all sort of points here. So moving specifically on the next slide to specific considerations we would leave with you in a disaster context, and Kate will get into a little bit of this later on, is sort of having these sort of 4 buckets of information we think about as sort of very specific context to start with. And one is just understanding that there's different levels of relief that are going to be available to immigrants, particularly if we're talking about an undocumented population, which is generally going to be ineligible for FEMA cash assistance or other forms of assistance. And even beyond an undocumented population, even those individuals that might have temporary protected status or DACA or are in the asylum seeking process will also have various limitations on what sort of federal relief are available to them. And so it's just important to understand that there's this baseline barrier that immigrants are going to face in the community that others will not, in terms of federal relief resources available to them, and building that into response strategy is really important. The second piece is sort of inescapable, which is that there's this really hostile climate, and Sally just talked about that a little bit before, about the fear that a lot of immigrants have, regardless of status, to accept support, whether it's coming from the government or foundations, and that's really heightened at a level we haven't seen in a long time. Many of you probably woke up to the news this morning about this renewed threat of mass deportations of families, and so that's going to have an obvious impact on someone's willingness to reach out, accept help, open a door. And so having that knowledge really plays into a long-term strategy of understanding, if we truly want to support immigrants in a disaster context, we have to have plans to get past that lack of trust, and how do we build it. The third point is really appreciating the fact that the organizations that are best suited to support immigrants even before disaster are often those sort of mom and pop local organizations that perhaps have strong linguistic, cultural fluency, are really connected to the community. Many of the staff are of and live in the community, but they are very often under-resourced in the first place. They have often limited grant-making capacity and are stuck in this sort of catch-22, where they don't have the funds to hire the grant writer to raise the funds to grow, and it sort of goes. And the reason this is important is these are the organizations that are closest to immigrant communities often, and are where those immigrants are going to turn if they do turn for support. And so thinking about the infrastructure that exists to serve the community before disaster is going to be really important for thinking about how you support them during and after. And then the last point here is fairly obvious, which is just bears repeating, though, is that immigrants, again, those who are undocumented, are subject to exploitation in the best of times, whether it's wage and hour violations or unsafe working conditions. And so disasters, unfortunately, add a level of risk to that, particularly when we appreciate the fact that many immigrants are working in outdoor industries, agricultural construction that may be disrupted as a result of a disaster, and so may find themselves at increased desperation or increased risk of exploitation in sort of this recovery and rebuilding phase. And then the other piece here is just the loss of papers and documentation for any individual in the community is always sort of a risk and consideration in a disaster context. But when you're talking about someone's ability to prove their ability to reside and work in the country, and the loss of that paperwork can be really devastating in a disaster for immigrants. And then also there are immigrants who have designated work or communities that they're supposed to live or work in as terms of their visa. And so if they're displaced from that workplace or that community in a disaster, that is going to be another big challenge for them to overcome. So on the next slide, there's sort of 3 recommendations we would make about how to actually prepare to support immigrants with these contexts in mind. The first, I can't bear, this really needs to be stressed, is it has to happen before disaster strikes. If you are in the middle of a disaster, at the end of a disaster, and thinking, oh my goodness, there are immigrants in the community, how do we support them? Yes, do that and think about it, but it's almost too late at that point. And this really goes to the idea of building trust and knowledge of your community beforehand. So we really encourage funders who are serious about this to understand the community. What are the demographics of the immigrant community? What countries do they hail from? What languages do they speak? What organizations are already serving them? What does the landscape look like? Are they geographically isolated from other parts of the community? Are they more at risk for disaster? Are they physically separated by physical infrastructures like highways or throughways? And just understanding actually what the immigrant context is for your community is first and foremost necessary to build an adequate response to that. And part of that is also understanding who are the natural leaders in this space, who are the contexts that immigrants are going to call on. What are those community spaces of churches or community centers that can be tapped in a disaster context and building relationships before the disaster strikes. The second piece is to really think about what an equitable response would mean. So often when there's disasters, there are resources that flow from outside of the local region. People around the country want to help. And those resources go to the most prominent, well-known organizations in the area that are being lifted up, which very often are not going to be those mom and pop groups we talked about. And so being aware of the disparate resources that are coming locally and nationally in a disaster is really important, and making a deliberate commitment to supporting those groups that make the most sense. And also thinking about what partnerships can be established. So some of those smaller groups might not have the full response capacity to receive a large infusion of resources, but maybe there's partnerships that can be leveraged that include them in their response. And then the last part here is really just, there needs to be a commitment. So making sure that supporting immigrants in disaster context doesn't mean you just connect to that immigrant group and say, okay, we're going to work with you in a disaster, but actually having a differentiated approach and requiring that of the grantees. So maybe you don't actually even have many of those small mom and pops, and you have to rely on the groups that are established community organizations. Make sure that they're prepared to deploy multilingual resources and translated materials or translators. If they're doing assessments and determination for federal eligibility, they need to understand what people are not eligible for. And then also thinking about, how do you signal to a community, particularly an undocumented community, that they're safe places for them to come to without necessarily advertising that in a way that's going to put them at risk for targeting by ICE, and really working with community stakeholders to figure out how you do that. And then a last piece here is that I mentioned earlier, a lot of federal resources aren't going to be available to undocumented immigrants. And so almost as a challenge to funders and philanthropy, what resources are you willing to invest to make up for that lack of federal availability? So moving to the next piece here, I think it's important to think about not just the immediacy, but also the long term. And so there's three things here we would say to do after a disaster. One is go back and think about how you bolster the capacity of those immigrant serving organizations. And so that might mean that you identified those local community groups, those mom and pop shops, and you commit to rebuilding their capacity over time. Maybe they don't exist, and so you're going to seed or explore how you create those resources. Another is to think about what are the underlying issues that these immigrants were facing before disaster struck. And this might be housing instability, inability to still access legal services, challenges in the workforce, mental health needs. And so really committing to making sure those resources are available in the community at large, but also that there's specific outreach and access for immigrant communities. And then the third piece is to do an assessment of how you did. Right, so understand there's going to be a learning curve if you're incorporating for the first time immigrant-specific strategies. Soliciting the input of the community, how did you do? And being prepared to pivot in response. So I'm going to pause here for a second and just check in with our facilitator. I'm not sure how I'm doing on time, but I can skip this discussion about GCIR.
You are doing, Kevin, you're doing great. Keep on going.
Great, okay. So on the next slide, I wanted to just quickly share where some of our learnings come from in this. Obviously, part of it is through our deep experience over the last 30 years in working with immigrant communities and funders, but also in 2017, GCIR had the experience of directly trying to figure out how to do this work. And so folks may remember in late 2017, there was a range of wildfires in Northern California, over 250 in fact, over the course of that month, that destroyed almost 250,000 acres of land, resulted in almost 100,000 evacuations. Unfortunately, several dozen individuals were killed, and over $14 billion in property damage occurred. And so during this time, there was a growing awareness that in this region of the state, which was, there's a lot of agricultural land and a significant immigrant population, recognition that there weren't a lot of resources and support being made available for these individuals. And as I said before, they weren't eligible for federal relief. And so we partnered with a few local entities, the Brayton Day Labor Center, the North Bay Organizing Project, the North Bay Jobs of Justice, to create something we called a DocuFund. And this was essentially going to be a pool of resources specifically for undocumented individuals to meet their basic needs, whether it was temporary housing or medical expenses, tools and equipment repair for their jobs. And through this effort, we partnered with over 30 foundations, over 8,500 individual donors got involved, and $6 million was raised and deployed to the immigrant community. Over 2,000 families, over 7,000 people were impacted through this giving. And through this work, we had 100 volunteers. There was 30 clinics in the community. There was a temporary coordinator hired to do this. And so this was sort of a pretty big effort. And the reason I shared this is a lot of the learnings I shared with you today came from us doing this and through this sort of process of navigating through that. And then also very important, we did a debrief with the beneficiaries of this fund to understand what about this process worked, what didn't work. And so just to share with you some of the key things that came out from these community groups was they needed to find better ways to work together and not wait for the police or emergency resources, having their important and personal documents at the ready, knowing and having relationships with their neighbors. And the implication there is there's a real need and space for philanthropy to support community groups and think about how do you build community and how do you do education around disaster preparedness in immigrant-specific communities. Another thing is they said that their top needs that they were struggling with in the short term were physical and mental health. There's a lot of trauma associated with going through disaster and a need for financial service assistance. And so this speaks to the earlier point about investing in community services and support with an immigrant-specific frame. And then lastly, some of the long-term persistent needs that immigrants identified were having a better alert system and one that was going to be responsive and accessible to folks that spoke multiple languages. And the number one challenge that they raised was adequate and affordable housing, which was an issue before the disaster, the high cost of housing, and was doubly so after. And so again, this then speaks to this sort of root causes issue of getting involved in perhaps policy or systems change work to create better housing conditions so that immigrants could actually better weather a disaster context. So going to sort of to close here, the main points I would re-stress and leave with you is one, understand the community, who's there, what are the resources, what is the infrastructure, who are the leaders, commit to an inclusive response both as a foundation and of your grantees, understand and address what are the underlying challenges because really the needs of immigrants in disaster contexts are very similar to the community at large, but they're exacerbated and perhaps have some unique twists because of their status or language barriers. And so address some of those challenges. And then finally, really think about long-term capacity, building up those infrastructures and networks and supports that are going to allow communities to quickly be supported and rebuild. So happy to take questions later on. And again, thanks to our hosts for organizing this conversation.
Kevin, thank you so much. This is really informative. I love the 4 points that you just wrapped us up with. They're so critical and so important to the work that we're doing currently in Harvey affected Texas as well as across the country. So appreciate you putting that so succinctly. You've certainly given us all a lot to consider and think about, and as we all focus on our support on helping immigrant communities. And don't forget, everybody, Kevin's going to be able to answer your questions following Kate's presentation. So I haven't seen any questions pop up yet, but by all means, start popping them in there as you think of them. Our final presenter is going to be Kate Vickery. Kate Vickery, the Executive Director of HILSC. Kate?
This will be a victory of a presentation, so don't worry, that was perfect.
Oh, good. Okay, good.
Hi, everybody. I'm really happy to be here, and I'm hoping with my presentation to dig in a little bit more into some of the themes that Kevin listed up and Sally as well. And it's been really an honor to be able to work both with GCIR and with CDP in this space and to learn. So I'm going to go. I have to warn you. We are the Legal Services Collaborative. I am not a lawyer. I am going to get a little wonky with you, but I think I want to do a little bit of education around a couple of key policy areas that I think it's really important for us to understand when we're thinking about the intersection between immigration and disasters. And on my first slide here, I just want to uplift what you're seeing here is a picture of my organization. We hosted 2 legal services tables at the 2 largest shelters during Hurricane Harvey. This is where our experience around disasters and immigrants come from. And we were there providing brief services and legal advice. And mostly we became, as you'll see at those posters on the wall, we became the de facto interpretation and translation hubs for the 2 shelters that were housing between 5,000 and 10,000 people at any one time. There was no other place in those shelters where language access was happening. And because our table said immigration on it, that's where this was an organic thing. We didn't plan this, volunteers did this for us. And the attorneys that were working at those tables were, their most important work was actually educating FEMA about its own eligibility requirements for people who are not U.S. citizens. And so a lot of what they were doing was advocating for folks who were trying to register for FEMA in the shelters themselves. Go ahead and advance. So I want to give us a little bit of context, and I lift this up in reaction also to what Kevin said about the need to really understand for your local context. I realize that you are not all from Houston or even from Texas, to understand some of these data points for your place in order to understand how you can invest and support this particular population. So in Houston and the greater Houston region, 1 in 4 residents was born in another country. 10% of our population is, so it's 1.6 million people who are foreign born, a quarter of our population, and 10% of our population is estimated to be undocumented fully. And almost half of the children who live in our region live with at least one foreign born family member, and about 250,000 children live with at least one undocumented family member. So when we talk about mixed status families, those are the family members that we're talking about, and this is a huge percentage of our population. Next slide. So it's also important to understand the contributions of immigrants to your local economy. I think this is really an important piece of context to understand. For Houston, about 26% of our local GDP is contributed by foreign-born residents. They hold a significant amount of spending power for our local area, and a huge percentage of our workforce are immigrants. Half of our construction industry is foreign-born. 10% of our overall workforce is undocumented. And I say this, and I also want to note that it's really important that when we talk about the need to support immigrant communities, that we're not doing so just in the context of commodifying immigrants because of their labor and their importance to the economy. But when we think about recovery, the folks who are doing much of the recovery, and Kevin lifted up the risks and the exploitation that often happens for immigrant workers in Houston and in many other places as well. The second responders, the folks that are doing the cleanup and the recovery work and that dirty work, are largely immigrant. And so ensuring that we have the resources to protect those families and keep them safe is really important. Next slide. So we didn't think as an organization that we had anything to do with immigration or with disaster recovery, excuse me, but we run a listserv with about 400 staff members of various immigrant serving organizations. These are everyone from the mom and pop size organizations that Kevin highlighted to the more established legal services organizations that serve thousands of people at any one time. But these are the deeply rooted immigrant serving organizations that really have the support and the trust of the community. And within about 8 hours of Hurricane Harvey popping up, our listserv started to get questions like these from advocates that they were hearing from their clients. We also started getting these questions on our hotline that we run, and legal services providers were getting these as well. So I just want to highlight just a couple of these things that are really specific to an immigrant context that no other population needs to worry about. And this first one is, and this happened multiple times, asylum seekers who have been released from family detention centers who are saddled with an ankle monitor that has to be charged on a regular basis, being afraid to leave their home because of their inability to keep an ankle monitor charged. So they were making a decision about whether or not they could leave a flooded home with children in the house because of what happens if their ankle monitor goes off. and what that means in terms of their case and potential deportation. We got a lot of questions about whether or not it was safe to go to a shelter or a food bank if people were undocumented, and we had a lot of folks who were being referred through the primary social services referral database, which in Houston is the United Way's 211 system. I think many of you have similar systems in your location. So people without a social security number would call that number asking for a referral to a local food bank, and they would arrive at that food bank and be asked for a social security number upon entry, because many of our social services agencies assume that they just are sort of blind to the fact that that in and of itself is a barrier for services. Lots of questions about whether or not somebody qualified for FEMA, and whether or not if they did qualify for FEMA, that accepting FEMA benefits would affect their immigration status or an immigration application that they had pending. So lots of questions, and this flood of questions was our moment to realize that, oh, we do have something to do here. No one else is sort of providing this glue between the immigration expertise and the disaster recovery expertise, and so we have tried to become that glue and that expert. Go ahead. So I told you that I was going to get a little bit wonky, and again, you can freeze frame this later and go back to it, but FEMA is in fact available to some immigrants, not all. There are lots of exclusions. I want to touch on that first. I do want to touch on that. So the language in the law is that you must be a qualified alien, and I do realize that alien is a incredibly triggering and disrespectful word to use, but that's the language in our federal law. And so to be a qualified alien means that so legal permanent residents are eligible, as well as a number of other types of immigrants who have had a grant of some sort of immigration status, like asylum or as a refugee, and as well as the U.S. citizen children of people without legal status. So if there is a U.S. citizen child in the household, that household is eligible to apply for status, to apply for FEMA. Next slide. So Kevin flags that there are specific groups that are ineligible for FEMA, and I want to name those specifically. And I just want to give you a sense, at least in the Houston region, of how many people we're talking about. I think we often sort of say, oh yes, well there are some people who aren't eligible, but it's not that many people. So if you're outright undocumented, you are not eligible for FEMA. I left that off my chart. In Houston, that's 506,000 people. If you have a non-immigrant visa, like a work visa, a student visa, even if you're living like an H-1B, for example, you are ineligible. In Houston, that's about 83,000 people. If you have temporary protected status, we have people, many people with TPS status have been living in the United States for 10, 15, sometimes 20 years. They are ineligible for FEMA benefits. That's 21,000 people in the Houston region. Folks with deferred action for childhood arrivals, the DACA program that you've heard about. In Houston, that's 36,000 people. So again, these are folks with a form of legal status authorized by the government, but ineligible for FEMA benefits. As well as even if you get a temporary Social Security number when you have a pending asylum application. And in Houston, we have about 30,000 pending asylum applications of folks who are living in the region. That does not make you eligible for FEMA, even though you do have a temporary Social Security number. So I just want to really lift up, how many people are left out of this kind of primary ability to get the most basic form of disaster recovery funding, and the need for private funders to really step in and fill that gap. The other wonky thing that I want to talk about, next slide, is public charge. And there's been a lot of information sent out, and I'm not going to get into all the details here, but rumors about public charge. Public charge is what an evaluation that the federal government does for an immigrant when they are, that can make them ineligible to get a green card or legal permanent residency status if the government determines that the person may come to depend on the government as their main source of support. It's effectively an income test, right? And it keeps low-income people off of the immigration rolls. Right now, what it means to be determined to be a public charge, which again can keep you from getting a green card, is they make an analysis based on whether or not you you depend on cash support such as Social Security income or TANF, or long-term institutional care. Next slide. the public charge assessment, like I said, is for when people are applying to become a legal permanent resident or applying for entrance to the U.S. from abroad. This is especially true for family reunification visas. So a family member petitioning for a relative leaving abroad, or if a legal permanent resident leaves the United States for 180 days or more and seeks to re-enter, this test is applied. Next slide. So the public charge test is being proposed to change to include a whole bunch of additional cash benefits. And the details of this doesn't matter for all of you, but what is important to note is that the drafts of these change rules started being leaked in early 2017. And there have been, it's been wildly misreported. Kevin talked a lot about the kind of the misinformation that's swirling around. Just the fact that information is in the world about the fact that more public benefit programs will make you subject to the public charge test has resulted in many immigrants being less likely and less willing to seek assistance, even from some of those trusted, deep-rooted mom and pop shops that have been providing assistance for a long time. Next slide. So I want to note that disaster relief, there are many non-cash benefits that are not affected by the changes, and disaster relief is one of them, as well as the rest of the programs that are on this table. But here's the deal. Well, before I do my here's the deal, so next slide. There are also various categories of particularly vulnerable immigrants who are exempted from public charge, and that includes refugees, asylees, and a number of, all of these are U visas, VAWA, C visas. These are sort of the types of visas that are available to the most vulnerable immigrants. All of these folks are exempt from the public charge rule. However, what we've seen is that in practice, despite the fact that disaster relief, all of those types of programs are exempt, that many different types of immigrants are exempt, that health centers, food banks, and hospital districts all across Texas have already reported widespread dropping out of all sorts of public benefit programs by families who are still eligible for those services. You can advance to the next slide. So I just want to highlight two quick examples of that. On the left here, ECHOS is an organization in Houston that serves about 50% of their clientele are folks without legal status. They've seen in the past year a decline in people applying for CHIP by 28%, and that renewals for food stamps and SNAP have plunged by 1/3. However, the number of families who've used their food bank has gone up threefold. So it's not that the need is changing, it's that people are choosing to drop out of those programs. And nationally, the Urban Institute just published a report just last month, in May, that has found that 1 in 5 low-income immigrant adults, these are national statistics, have reported dropping out or failing to access a non-cash benefit program that they would be eligible for. These are staggering numbers, and this contributes to the need for really trusted organizations early on to be invested in to be able to provide support. Next slide. This is a whole story that you can read later, but I want to uplift one client story that from a grantee that we supported with some of our Harvey relief direct cash assistance funding that was intended for, it was only available to undocumented individuals and mixed status households. This was a family who, when they were offered the funding in order to do mold remediation in their house, was making a decision about whether or not they should use that cash stipend to do mold remediation or to pay for a lawyer to get their husband out of detention because they had been picked up on a drive to work. So these sort of impossible choices and this added threat and risk of deportation and detention for many of our immigrant families makes the choices about how to use recovery money even more difficult. And I think one of our lessons learned is that when making funding available for immigrant families, making it as flexible as possible so those households and those individuals can make the choice for what's going to allow their family to thrive in the best way that they know how. That's been really, really clear and key. So I'm realizing that I'm running out of time. On the next slide, I just want to uplift, and I'm going to preview a little bit something we're going to talk about on the next of these webinars, which is we have put a lot of our recommendations and lessons learned about sort of themes for how we can improve response and recovery for immigrants in a plan called the Humanitarian Action Plan, which is available on our website. These are three of the big themes that we've really hit on around inclusive communication, which Kevin touched on, making sure that resources are really accessible, not just linguistically, but also at the right literacy level, and also really focusing on culturally competent approaches. You can advance 2 slides for me, Regine, please. So my final takeaways are that what we should be doing as funders is really providing private funding to organizations that are deeply rooted in immigrant communities, that are trusted, and that have a track record of serving immigrants. I think we've seen a lot locally, organizations, you know, smell disaster recovery money and say, oh, yes, we serve everybody, we're very open, but they don't actually have a track record of being a trusted partner or of serving many immigrants or foreign-born or limited English proficiency clients, and they aren't actually able to do as much support as you would like. I call on everybody to really get educated about what the barriers are to immigrant recovery and to do everything you can to break down those barriers. This is also a little teaser for the next webinar where we'll be digging into one of the tools that we've created called the Immigrant Accessibility Index that helps break down barriers. To really focus in our case management funding to focus on culturally competent case management, which is around language, literacy, being trauma informed and really sensitive to the particular needs of immigrants. And to provide capacity building to immigrant serving organizations so they're fully prepared for a disaster. So we're doing trainings for organizations on continuation of operations planning so that the immigrant serving organizations don't have to shutter their doors when a disaster hits, that they're able to keep up and running because they're prepared on how to do that. And then finally, and this is really where Sally and I have partnered up with, and the Center for Disaster Philanthropy has funded some of this work. Funding legal services as part of recovery preparation and response is about long-term recovery. Not having legal status is in and of itself a barrier to recovery, and funding immigration legal services to help people get status is a long-term strategy, and in some ways is more sustainable than you know, a check to help people buy a new refrigerator because theirs had to be thrown away. So I want to end there. And thank you so much for listening, and I'll take questions at the end.
Thank you so much, Kate. Your remarks are just so incredibly insightful. I'm going to take moderator privilege and ask a question, and I think it should go to Kate and Kevin, but certainly, Sally, don't be bashful if you have something to add as well. You know, in my head, I'm thinking about, you know, the news today about the ICE raids and deportation, and as well as the discussion that's been ongoing about the census. So I'm curious, how does the current political atmosphere affect reaching immigrant populations as it relates to disasters, and how can we combat that and still reach them?
This is Kevin. I'll jump in on this first, and then I'm sure Kate might have something to add. This goes back to sort of my remarks in the beginning of my presentation. Is really about this question of whether, as a funder, we want to look at immigrants as members of community that we're going to deploy services to, or do we want to look at the bigger picture context in which they live and look at immigration as a policy issue and think about how do we change systems that are impacting their lives. Obviously, as I mentioned before, like the context is going to be different for every funder based on experience, level of comfort, you know, knowledge, et cetera. But as GCIR, you know, our sort of position is, you know, all work to support a community, particularly immigrants, needs to be grounded or should be grounded in a bigger picture context. Like immigrants don't live in isolation from the political context. And so the fact that we are living in a time where the administration is doing everything possible to demonize and exclude and kick out and ban immigrants, I think is hugely problematic. And, you know, one of the things I think about when we provide services to immigrant communities is, are we doing that in a way that just allows them to subsist, or are we creating the conditions where they can really thrive and be whole members of the community? And part of that means that we have a welcoming narrative and set of policies that really embrace and uplift the contributions of immigrants. So I would say, you know, to funders, and this is something we can definitely, you know, talk with folks about if they're interested in exploring, there's a real need to push back on the policies and the threats and the, you know, locking up of kids in cages and separating families. Like this definitely is a crisis for our democracy at this point in time. And it's really an opportunity for people to step up and think about how to support strategies that build welcoming, inclusive communities. Because without that, you know, if you're supporting someone through disaster, great, but what is the world that they're returning to? So I would encourage this bigger picture perspective beyond the immediacy of the disaster. To the question of how do you reach them outside of this like bigger picture question, I think Kate really talked about that, like connecting to those groups that have the track record of success and trust and legitimacy in their communities is probably a more effective way than just trying to create an entirely new strategy or organization that's not connected in a deep way to the community. But I'll stop there, and Kate or Sally may have more thoughts to add.
I agree with that, Kevin. This is Kate, and I would just add to that. I think the other, you know, the national policy arena is absolutely a part of what we're talking about. But I would also say that at the local level, we're thinking about this a lot, right? So, for example, in what ways are our, not just the nonprofit community, in what ways is our local Office of Emergency Management equipped to and ready to ensure that they are getting their information, messaging, and services out to everyone in the community? We just had an interesting meeting with them talking about how we were going to build up infrastructure to support asylum seekers who are arriving in greater numbers from the border, right? And you know, they don't think of busloads of thousands of asylum seekers arriving in Houston as an emergency in the OEM context. But I would argue that every asylum seeker who's living in the greater Houston region is the responsibility of our local OEM. And so how are our local government institutions and those emergency management institutions prepared to and taking seriously the responsibility that our immigrants, our undocumented neighbors, and our refugee neighbors are not an afterthought? This is, you know, I think we hear this narrative a lot where people will say, oh, we know that we're not reaching undocumented people. We know that undocumented people aren't eligible for FEMA, or we know it's difficult. You know, they're just too afraid to ask for help. And that's a cop-out, and I reject it wholeheartedly. I think if we are not setting up our local institutions to think holistically about how they're communicating with our entire population and treating those communities as fully fledged members of our communities, exactly as Kevin is saying, then those institutions are failing as well. So that's another point of advocacy.
Thanks for that, Kate and Kevin. Sally, question for you. When in your presentation, you gave us a really great view into specific realities. Can you talk more about CDP's broader work in support of immigrant communities?
Sure, I can. We initially, it's kind of we look at everything that we do through an equity lens. So, like I said in my presentation, you have to address the needs of the whole community, and those affected by disasters are obviously most affected are our most vulnerable communities. They're the ones that have the most difficulty recovering. So we very intentionally focused on funding our most vulnerable folks and looked at everything we did through an equity lens. So everyone that we have funded, we have encouraged and sent them to experts or know that they are the local folks that are working with these populations. Kate and her team at HILSC have been great allies in helping us identify folks that we can support. And I know that throughout CDP, throughout all of our funding, I'm one grant maker with one fund, but we all use that equity lens to do our work and to make sure that we're helping the most vulnerable post-disaster. But I think we also look bigger picture at long-term recovery. So how can we help build up the communities that we're working in to be more resilient? So as Kate and Kevin have both been very clear about, looking at the long-term resiliency of these communities is particularly important. And so we've done a lot of work in building capacity of organizations that are working here in recovery for Harvey and making sure that they have sustainable, they are able to sustain the recovery work that they're doing. So I think that's something that has to be considered as a funder. You have to look at, you know, not just addressing the immediate need, but looking at how can we prevent that need from reoccurring.
Thanks for that. That's helpful. Kate, I'm going to turn now to an audience question. This is a low-hanging fruit one. Question from the audience of where did you get your eligibility stats from on the who is not eligible for FEMA slide?
Sure, absolutely. So the eligible, in terms of who's not eligible, we did our own research on that. And I would have to go back to find exactly where the sources of those particular statuses are. They're in the code somewhere. I can send you the code. But the numbers come from a study that we commissioned from the Migration Policy Institute. There are two really high quality research institutes on immigration, Migration Policy Institute in DC and the Center for Migration Studies in New York. They both do really excellent data, and MPI did our local analysis, which is why we know how many DACA recipients we have, how many TPS holders we have, how many asylum seekers we have, as well as the breakdown of legal status in our place. And I would be happy to provide a link to that study in the follow-ups that will come from CDP.
Great, thanks for that. We've got, I'm reading off the page now, so you're gonna be able to tell that. Wait, hold on, there we go. While our work is an immediate response, we often get asked who undocumented survivors can go to. We've always sent them to FEMA where they've been welcomed. Several of them have walked away after seeing DHS police there. Is there another place where I can guide them to, a specific organization? Question is first for shelter and second for advice on what their next steps should be, besides the obvious Red Cross and such.
This is Kate, I'll take that. So I think that, this is a little bit hard. I think this is, I guess my cop-out answer is, it's not a cop-out. Folks know where they're going to go, I think, up front. So in Houston, a lot of the shelters that were not the big Red Cross shelters, where most of the immigrant communities, that, especially those that are particularly isolated, most of those shelters were sort of informal shelters that were happening in people's churches or community organizations. The large Red Cross shelters were in many ways the least accessible for immigrants, and the Red Cross has an inclusivity statement that is supposed to indicate that immigrants are safe in Red Cross shelters. But what we found in Houston was that because the Department of Homeland Security is often brought in as additional security for in shelters, we actually had ICE agents present in shelters. They weren't doing enforcement actions, but they were there as law enforcement. And so all it takes is one tweet, one Facebook message saying that ICE is present in a shelter, and nobody's coming to those major shelters. So it's the informal networks, and many of them are faith-based, or some of the cultural organizations, like our local Chinese Community Center is a go-to shelter because they already have people who come to them on a regular basis. So I think, this is also sort of to the point of, if we're asking this question after the fact, then we're already too late. These organizations are already known to the immigrant communities, and they will become resources whether or not they are funded by big funders or officially on any list.
Thanks, Kate. Hey, I'm going to read. I saw the participant list, and I knew that there were several FEMA folks on the line, and one of our FEMA colleagues just said, type this in, and I want to read it because I think it's important. And then I'm going to zip us through our closeout so that everybody can hop on to their next meeting or next portion of their day. But one of the FEMA participants just said, just wanted to say thank you so much. A bunch of us day-to-day staff are here with you today from FEMA, and we hear you. We're working diligently to elevate these concerns in our localized disaster recovery efforts in collaboration with state and local partners and organizations. Thank you for this important work you do each day and for this great event organization. So I have to say I appreciate that, seeing that, and I appreciate all of you who asked questions that we weren't able to get to today. My apologies, but we need to keep this webinar to an hour, and so this is really all the time that we have for right now. To those of you who may be planning disaster response funding, the Center for Disaster Philanthropy has many additional resources and information in our disaster playbook. You can find it at www.disasterplaybook.org. We've also created a list of suggestions for foundations to consider related to disaster giving, and they're right here, and they start with take the long view, think about community demographics. Know that being without a legal status is a huge barrier, and we've heard all about that today. And then recognize also that there's places where private philanthropy can help. I want to really thank Kate, Kevin, and Sally for their time to share all of their insights with us. I'd like to give special thanks to our co-hosts, Grantmakers Concerned with Immigrants and Refugees, and the Houston Immigration Legal Services Collaborative. If you do have questions that you want follow-up on, by all means, please email me. I'm at regine.webster@disasterphilanthropy.org. I'll make sure to triage any question that you have out to the experts on the call. And lastly, I'll just say thank you all to all of you for joining us today, and then also for your interest in this important topic. And have a nice afternoon.